Good afternoon, everyone. My name is Sophie Trezise. I'm a digital transformation lead at Berkshire NHS Foundation Trust. My background is as a clinician in learning disabilities and mental health services, and most recently the Global Digital Exemplar Benefits Lead for the Trust. So I feel quite passionate about using digital innovation to provide sustainable healthcare. So I'm really excited to be able to share with you Berkshire Healthcare's journey and the benefits realised for the Mood Diary. So the benefits that you'll see on this slide were the tangible benefits that we were able to effectively measure in agreement with NHS Digital under the Global Digital Exemplar programme. But I really appreciate there will be many, many more. So it was to improve patient safety and access to safety plans, also to improve the quality of our safety plans, as well as their distribution to our patients, improve our patients' overall experience of our services, also improve our treatment planning, and finally, reduction in suicide and self-harm rates. So this graph that you can see on the slide, it shows the percentage of our Mood Diary app patients that had a safety plan created and had access to the document. And the blue stats outline since going live the improvement with 100% having a safety plan when onboarded to the app in March of 2021. What I think the app really helped for us is that it proved that the Mood Diary could mitigate the risks of plans not being available or misplaced, providing patients with 24-hour access to their most up-to-date safety plan in a safe and secure location. And what I really like about the Mood Diary is the digital process has really provided more empowerment for patients to view information recorded within their safety plan at time of need, with the accessibility of being easily located on any mobile device. And I think it's nice that patients are not reliant on mental health care professionals to send their safety plan either via post or in person or send via secure email. Because once it's all finalised with their clinicians, saved within the Trust main EPR, the access is instant. So it really improves that overall patient experience of our services and also access to our treatment tools. So what this graph demonstrates is the number of patients that use the Mood Diary recording functionality that you saw earlier with Lee. During the pilot phase, so the Trust, we supported 335 patients, of which they recorded just over 5,000 mood recordings. And I think having access to this information outside of appointment times was really valuable to our clinicians, particularly when arranging appointments in lockdown conditions, which I think we all thought was really challenging at the time. So what it's told us really is as a result of having access to mood recordings, the digital safety plan, crisis support contact numbers and web links, it's really improved patient engagement with their safety crisis plan, but also supported a more proactive care approach and experience. I also think the accessibility issue in the past also maybe deterred the validity of the document with some of our clinicians, as it sometimes wasn't always seen as a supportive risk management tool. But by removing those barriers, by making it digital, it's really started to grow those conversations and supported a more co-productive, collaborative approach. So we completed a patient survey in August of 2020, which provided us with a really good oversight of what aspects of the Mood Diary app patients found the most useful. What was really pleasing to see from all the responses we received, the majority felt that recording their moods and their reasons was the most useful element of the app. Patients also reported that they liked having access to the safety plan digitally, and they did prefer that over their previous paper versions. What I really like to see from the feedback of all the patients who did respond to our survey is that 77% felt their safety plan was co-produced with them. Probably one of the most impactful user stories I would love to share with you was with a patient who, whilst on holiday, decided to stop using their medication, and as a result became very unwell and was starting to exhibit thoughts of self-harm and suicide. They were recording daily on their app of wanting to harm themselves, take their own life, and these words the patient used triggered a response in our Mood Diary keyword report, which Lee showed earlier, which was monitored daily by our project team. And what this enabled us to do was to act really quickly. It was a really quick response from our project manager, who alerted the team supporting that patient's care, who made contact with that individual and supported them through their period of crisis. So although the Mood Diary is not designed as a crisis response line, it was not expected of the clinicians to review every patient mood recording on a daily basis. But what the app alongside the key work report did was enable us, was really incredibly valuable. as it provided another opportunity for us to safeguard those under our care, and some assurance also that those who were requiring more immediate support were recognised quickly. I wanted to further share with you some of the staff quotes of their experiences of using the Mood Diary app to inform their clinical practice. I won't read all the quotes out loud, but I just wanted to pick out a few main themes of support. So staff reported that the Mood Diary app had provided opportunities to review ahead of appointment times when a client's mood had been low, and it really helped them to build up a better picture of periods of difficulty and triggers with specific times of day, really helping them to underpin what those root causes were. And I think we can all appreciate that sometimes it's really challenging for patients to recall during a session when their moods have been low, or they might have forgotten entirely, making it really hard to pinpoint triggers and interventions that might help them. So the app has really provided an opportunity for both clinicians and patients to have a more open dialogue on support needs that are going to work with that person. Staff have also raised that during the pandemic, as I'm sure all of us have, that actually we've been mobile working more than ever, using laptops to record directly into the EPR for any clinical engagement on the go. So the Mood Diary app has really enabled them to embrace mobile, flexible working more, sort of negating that need to travel into an office location or at home to print off safety plans for the patient, because they're directly accessible via the app, which has been really lovely and pleasing to hear.